the other because they're required by law that they can't tell you one way or the other. But she was really close to getting her to dropping her managed care plan, and then for that, I mean, she wouldn't have been able to get on a supplement again. So again, there's a lot of things that people won't talk about. It's really important to do your research, talk to somebody who knows about it, just to make sure you're making the best decision for your care and for your family's care, because it's confusing and tricky, and they try to make you, think you're saving money a lot of times when it can really, in reality, be the opposite of that.
They still get their $8,000
right.
for your head.
Exactly.
So they don't care.
Exactly. And that's why they're like trying to like get you on their plan so much. And I want to be clear, managed care plans are really great for some people, right? Like if you don't have that monthly, if you don't have the ability to budget for that monthly, which a lot of us don't, and you're only seeing the doctor maybe once or twice a year, your condition's very manageable, and you're not traveling a lot, you're not living in multiple different places, sometimes those can be really great. And so you really just have to think about what's best for you and your family member, and to kind of do your research on which one's the best. Because
what do you mean the traveling thing? What is that?
It's because, so like snowbirds, for example, right? They live part of the time in Jackson and part of the time in Phoenix. If they're on a managed care plan, their plan's only going to be a network for a local geographic area. So even, so sometimes even people here in Utah, certain managed care plans don't cover down in St. George. So people who move from Salt Lake to St. George throughout the year, like, it's very localized. It's very like, they can choose your network because they're managing your care. Whereas this is like, USA is your network, anyone who covers Medicare covers you. That's what I mean by that. Yeah. Questions?
Part D's for drugs, it's under C.
Oh, sorry.
Supplement too, or?
No, it's just a separate part. It's like its own thing. So Part D is, we'll just put it up here.
Oh, well, you have to pay extra.
You have to pay extra if you have a supplement. It's like $12 to maybe $40 depending on the plan. I think Walmart's drug plan is the cheapest. It's like $13. And that's so like if you're A and B, you have your $135 premium for your B. That's like taken out of usually your Social Security. Like everyone pays that no matter what. And then your supplement, you have, let's say it's $130 to $150 a month in addition. And then you have to pay your Part B or your Part D premium, which again can be $12 to $40. So realistically, you could be looking at close to $300 sometimes going this route a month, which is still pretty good for unlimited care, essentially. It's usually better than what most people are used to through their employer, but it can be expensive. And then your Part C, your D is rolled into it, and you're looking at $0 to maybe $50 a month. But there's like lots of other hidden costs, right?
How much is the C?
Sorry?
How much would the C be approximately?
$0 to $50, depending. Yeah. Oh, sorry. In the C, Part D is included. Yeah. But again, there's other costs here. And also, this is maybe a conversation for another day. If you have more questions about Part D, we can talk about it. But Part D doesn't mean all your drugs are covered. There's like specific types of drugs that are covered at specific rates. There's also the donut hole that you may have heard of, where there's a period where you're not going to get any drug coverage. And Part D is the same here as it is the same here. The Part D does not change at all. You're not going to get different drug coverage over here than you are over here. It's just rolled in so you have one card, basically. So D coverage is its own beast. So if you have specific questions about Part D coverage, come and talk to me, because there's a lot that goes into Part D coverage. And like I said, there is a donut hole that kind of prevents you from getting coverage at certain points in the whole process. There's separate premiums, separate co-pay, separate out-of-pocket maximum, those types of things. So, okay, any other questions about that? And feel free, like I have cards here, and you can take one. Feel free to come up and talk to me if you have additional questions about it. Oops, because I know it can be like a lot. Okay, hey Gabby, how much time do we have?
You know, I was just coming to give you a heads up. So we're running into, we're a little over.
Oh, we're over. Okay.
Yes, but take your time.
No, I'll be quick.
We have a break before the next breakout session. The next breakout doesn't start until about 1:50.
Okay, we'll be quick. Okay, perfect. Okay, so I just really quickly, I really want to quickly just go over what's happening with Medicaid in Utah, because that's kind of a hot button thing that you're hearing a lot about. So Medicaid is another federal insurance, health insurance program provided mostly by federal funding, but supplemented with some state funding. It's income-based, so you have to meet a certain threshold to qualify for it. You may have heard last year there was a lot of hullabaloo in the news about Utah expanding Medicaid. Last year, Utah voters voted to expand Medicaid at 138% of the federal poverty level. Am I giving you the wrong slide? Yeah, that's fine. And then the legislature decided to go against what the voters voted for and implement a different Medicaid. So here's where we are. Last year they voted for Medicaid expansion, voters did. I think a little over half of voters voted for it. Instead, the legislature held an emergency session and passed SB 96, which is the bill that would implement their own version of Medicaid expansion. It started with the bridge plan waiver. They applied for a waiver with the federal government where they would cover everyone up to 100% of the federal poverty level, which is about $12,000 for an individual and about $25,000 for a family of 4. So everyone who makes under that a year would qualify for Medicaid in Utah. They applied for a waiver that would have the government pay for 70% of it, the federal government, and the state to pick up the remaining 30%. The federal government approved that waiver, and so as of April, anyone who makes under 100% or under of the federal poverty level qualifies. This is super, super helpful for our families because we have a lot of family members and friends who are unable to work enough to make more than that. So if you know someone who makes under $12,000, they are automatically can get Medicaid right now, which is a huge deal in Utah because that has not always been the case. As part of SB 96, the whole idea was that they would get the government to eventually pay more than 70% because that's costing Utah a lot of money, about $6 million a year, or $6 million a month extra in what they were paying before. So they applied for another waiver, which is the per capita cap waiver, and they basically said, hey, we still only want to cover up to 100% of the federal poverty level, but we want you, federal government, to pay for 90% of it. And the federal government was like, we're not going to do that because you have traditionally to do that, you have to cover more people. And so they said no. And so this is where we are right now in the process. They are working on a fallback waiver, which would cover 138% of the federal poverty level. So it would bring that number up from 12,000 to 17,000 and from 25,000 to 34,000 for a family of 4. So if you're a family of 4 that makes under 34,000, under this fallback waiver, you automatically get Medicaid, which is really wonderful for a lot of our kids, especially because the Georgetown Institute for, I think, Children's Policy just ranked Utah second in the state for the most amount of kids who are not covered with health insurance, second in the whole state, or in the whole country. It's awful, especially because we have so many kids and because we love kids here. So the reason why I'm telling you all this is because I think this community is really impacted by this legislation. We have a lot of people who would qualify for Medicaid if that bumped up from 100% to 138%. And right now, so when there are changes to Medicaid, when there's changes to Medicaid in the state, they require there to be a period of public commenting, which means you can go to this website. I'll click on it right now. It works. You can go to this website and you can make public comments about how you feel about Medicaid expansion. And the coolest part about this is when CMS, the Centers for Medicaid and Medicare Services, or when federal judges review this, they take public comments into account. So for example, a couple states, Kentucky and New Hampshire, just recently passed Medicaid expansion with work requirements, which means individuals, there's a lot of stipulations. You can be low income, you can't necessarily, but you have to work. Which you can imagine for our community is hard because if someone has a neuromuscular disease, they can't always work. So under these work requirements in these states, they would have to work to get their Medicaid. They'd have to work to get their health insurance, which makes sense for maybe individuals who are not wanting like a handout, quote unquote, but not for our community who can't work.
It must have SSDI though, right? Because if you have the Social Security disability insurance, you're exempt because you get Medicare.
Yes, exactly.
Okay.
This is for Medicaid only.
Because I was like, that sounds so cold, but
No, you're right. Yeah, this is for Medicaid only. Yeah.
Okay.
And the judges said, they took that to court, they appealed that. Federal judges said no because the overwhelming response in state through the public comments section was that they didn't agree with that. And I tell you this because sometimes it feels like you can't make a difference and that your voice can't be heard, especially the way our political system is set up right now. It can feel really overwhelming. It can feel like you can't do anything to help. But this is one example where you can, and you can do it so easily. It's literally just a form that you just go on and you type, yes, I'm in favor of Medicaid expansion up to 100, you know, you can type whatever you want. And when it gets to CMS, they will read that. Federal judges literally cited in their decision to overturn the Kentucky ruling that public comments indicated that people weren't in supportive of this work requirement piece. Like it literally cited public comments, and that like changed everything, yeah, for that state. And so now, individuals with neuromuscular disease in Kentucky can qualify for Medicaid as long as they're under a certain income, yeah. Yeah. So, and then I put this little, sorry, this is like not super helpful because you have to copy down tons of letters, but I put this website here because this is a copy of all the different Medicaid programs and the way you qualify for them. So that can be, there is also ways for medically needy individuals to qualify for Medicaid that isn't necessarily you have to make under a certain limit. There's other ways to qualify as well. So if you are interested in maybe, or know someone who's interested in qualifying for Medicaid, go to this website, look at all the programs, and you can kind of see if you qualify. Yeah. Okay, so we're over time, but if you have questions, please come and talk to me. I have cards you can take, and yeah, of course.